nationwide. What does this all mean for the COVID situation? We discuss in this episode of The Chiefs. To this special edition of The Chiefs. I'm Robbie Alampay, and with me online is Ed Lingao of One News. Later on, we will be joined by Ami Pamintuan of the Philippine Star. Pok, happy Friday.
And a happy weekend to you. Tatlong araw na lang, Lunes na ulit.
But we're still tracking the numbers, no? 13,000 today. 2 days straight of 12,000 plus. Now it's 13,000.
And I think what's really more alarming with that number is yung positivity rate. We're nearing a ratio of 1 out of every 4 na matest nagpa-positive. Nearing pa lang. Pero, you know.
Kanina nga, parang if I understood it correctly, kanina sa big story, so 13,000. Nung April surge, we actually hit 15,000.
15, yes.
But due to a technicality then, kasi may mga backlog no na biglang bumuo sa 15,000.
Yeah.
If you take that outlier, if you take that outlier of a day away, technically this is the highest.
Yeah, kasi if you look at the positivity rates nung summer surge, umabot lang siya ng mga 21%. Ang nagpo-positibo out of those tested. Ngayon, we're hitting almost 24.
23.9, ano? It's practically
20.6.
Oh.
Yeah. So that's a very clear indication na the numbers really aren't good. I mean, nagva-vary rin kasi yung new cases nagva-vary yan depending on the number of tests made. So you look at the ratios na lang.
But then, of course, kaya tayo nasa ECQ, precisely, government is hoping that this will somehow temper the rise in this number, although they are telling us also to brace for higher numbers. But there is some good news. Ay nagbukas na yung mega vaccination center sa Parañaque.
Pasay, sa Parañaque.
May drive-through option po yan. You don't have to be a resident of Parañaque. That's something to look forward to. And then maybe some other things. Baka meron tayong makuwaring magandang balita sa first guest natin. Joining us, Food and Drug Administration Director General Eric Domingo. Good evening, Dr. Domingo.
Hi, Doc.
Hi.
Magandang gabi po.
Good evening, Robbie. Good evening, Ed.
Sir, kamusta ba? Let's start with a general question on yung mga bakuna natin, options natin for helping our people to protect themselves. From your vantage point sa FDA, what are some developments as well as things that we can look forward to?
Well, ganun pa rin, we still have our 8 vaccines that are given EUA that have an emergency use authorization for use here. Ngayon, medyo dumadami na yung sources natin, no? Kasi like the Pfizer vaccines or the AstraZeneca, may mga several manufacturing na. Even yung Sinopharm, may natanggap tayo na manufactured yung parang packaged in the United Arab Emirates. These are all the same vaccines pero dumadami na yung sources. Yung pagbabago is probably the extension of the use of vaccines in children. Like yung Pfizer, we've already approved the use of the Pfizer vaccine in children 12-year-olds and above. Sa ibang bansa, at least sa Europa, yung Moderna, nag-apply na rin yan for children. Pagkatapos yung Sinovac, may application na rin yan na na-approve na sa China pero hindi pa rin niro-roll out.
Okay. Yun po
Sir,
Yung po sa Pfizer, yung 15, mayroon ng permit. Linawin ko lang po, no? Because yun namang mga technical advisors ng gobyerno, they're saying, teka muna, hold off tayo. Parang I just want to complete that connection between you giving EUA for 15 and to 18. Ano pa yung gap before we actually see that being rolled out?
Yeah, so technically it's like parang parang sinasabi ng FDA, okay, if you want to use it for 12-year-olds and above, you can use it. Our experts have seen that the benefit outweighs the risk and the profile is good for 12 to 16. Kaya lang ang problem talaga, of course, is that our supply is still quite short, no? Maliit pa yung supplies na natatanggap natin. At hindi pa natin natatapos yung priority populations natin, yung mga senior citizens.
Pero Doc, when you say na if you want to use it, kung gusto nyong gamitin, ang tinutukoy nyo gobyerno. If you want that
Gobyerno.
option, you're talking to government. So we're
Yes.
not talking about individuals who may say na you're not saying na kung kayo gusto niyo maghanap ng bakuna para sa bata, pwede niyo it still has to be government to make that decision.
Yes, government still sets the policy. These are emergency use authorization drugs that are used on a public health emergency. So ang Department of Health, ang NTF, sila pa rin ang nagde-decide ng ating prioritization list. Pero kapag umabot na tayo sa mga bata, at least meron na tayong isang option.
Well, sir, I understand that the FDA is still going through the application of Sputnik for its one-dose vaccine. So I understand you wouldn't want to preempt any decision along those lines. But is there anything you can tell us about that application and its chances of getting approved? I asked it kasi, well, it is a one-dose vaccine, and then if that gets approved kasi, that effectively halves our demand for vaccines. Imbes na 2 doses, isa na lang, plus of course we've heard from before that the Russians are willing to have manufacturing done here in the Philippines. So may mga dikit-dikit may mga sanga-sanga na ibang considerations What can you tell us about that?
You're right, Ed. No, it's a single-dose vaccine. It's like the Janssen vaccine. Na pag one dose ka lang, fully vaccinated ka na, and it does have some logistical advantages, no? Dahil single dose nga. It is now towards the final, ending part na ng evaluation ng ating experts at saka ng ating regulatory people. Yung tinitingnan lang yung manufacturing side, just to make sure of the quality, no? I think that I looked through some of the results that they said, and they're very, very encouraging. And in fact, it's been approved in 8 countries already, other than the Philippines, no? As a single dose, yung Sputnik Light nga ang pangalan niya na vaccine.
Parang San Miguel, di ba?
Parang ganun na nga. Pero isang isang tusok lang. So I believe by next week we'll make a decision on this.
Sir, if I may follow up on that, I'm wondering lang kasi last year kasi may interest talaga with Sputnik and Sputnik appeared to be interested in the Philippines. Pero I understand also that the numbers that we brought in of Sputnik are relatively low compared to the other vaccines. I'm wondering lang whether that has to do with the confidence with the vaccine or whether it's a commercial thing altogether.
No, it's a supply side problem, Ed, no? Sputnik is actually having difficulty supplying not just to the Philippines but all over the world, no?
Okay.
If you look through if you go through mga headlines ngayon, hindi nakaka-deliver kasi nagkaroon din ng spike ng cases sa Russia. So nagbabakuna din sila doon, no? At mukhang nagkaroon ng problem yung production nila that they're not able to deliver all of the orders. Particularly yung nga medyo problem natin yung second dose, no? Nung mga nabigyan na ng first dose. So worried the government, I know, is following up on their deliveries.
Sorry, if you could, you touched on it, but could you update us also on developments of, how do we, beyond yung mag-aangkat tayo ng mga bakuna dito, we've been talking about this for months already, the possibility of expanding our capacity to actually manufacture here in nabanggit na nga ni Ed din. There are companies that have already expressed, they've already said we were exploring these things. Nasaan na po tayo doon?
Well, nandun pa rin sa exploratory stages, kasi the DOST is leading this, and then they're working with the Department of Foreign Affairs and DTI to entice these companies to set up shop here and partner maybe with existing local drug manufacturers. So at this time, yun ang pinag-uusapan pa nila, syempre yung business side. Dahil kung magse-set up ka rin naman talaga ng factory at mag-i-invest ka, I'm sure there are some assurances that the companies would like, and I think dito yung point ngayon ng mga pinag-uusapan.
Ito po yung sa business side na banggit nyo. What about on the regulatory and FDA side? Meron po bang are there things to flag or even things to highlight?
No, actually we're on board in this, no. So pag may nakakausap sila, gusto nga namin bago pa mag-step ng factory, makausap ng FDA para alam clear agad kung ano yung requirements, kung ano yung standards na kailangan sundin, and that we promise that we will definitely evaluate all of this very, very quickly. Yung talagang sa ngayon hindi pa kasi talaga umaabot doon sa regulatory side. I think it's more of it's really more of the trade and business side that's being discussed right now.
You mean whether it's commercially feasible to do it here? That has to be decided on before you go into the regulatory process.
Yes, kasi yun ang main I mean, we are relatively a small country, no? Syempre kailangan naman mabubuhay yung yung negosyo pag pumunta dito. And I think yun yung mga hinahanap nila ngayon. Tinitingnan pa rin yung feasibility ng business side na yon. Pero doon sa regulatory side, nag-uusap na rin naman kami kung paano nga mapapabilis. Kasi yan, magre-rehistro muna syempre yung factory, they need a license, and then after that, each and every product has to be registered also with FDA.
Yes, sir. Sir, if you don't mind, let me back up a bit. Again, I'll ask you about Sputnik kasi it was last year when the Russian government, Gamaleya naman is government funded. When the Russian government, at least publicly, offered to put up a factory here. So I don't know if that already, if that was already one check mark on the list or hindi talaga yung garantisado.
Parang hindi I'm sorry, but I know they're not one of the I might be mistaken kasi hindi naman ako kasama lagi do sa trade and setting up the business part. But I'm not quite clear that they're one of the companies that are right now being talking to any local partner here, no. But I might be mistaken, no. Basta naman kasi nag-show ng interest, nagwo-work na agad yung Board of Investments natin kasi kinakausap na sila yung DFA natin if it's a government-to-government thing. So, we're really trying to make it easier because we want to start at least some, yung tinatawag nating fill and finish by next year na
At the very
kahit
least.
nadalhin dito yung bulk product, tapos dito natin ilalagay into the vial. So, I think this is the plan really to get somebody on board for at least for the fill and finish next year.
Whether it's I'd assume kasi, but this is an assumption lang. I'd assume kasi that it would be faster if it's a government thing. Whether it's Sputnik or Coronavac, or Sinopharm, which is made by the Chinese government.
Yeah, I would think hindi naman siguro malaki ang pagkakaiba kahit na private siya or government to government, no? Kasi pareho din naman ang requirements natin even setting up business and going through the regulatory process here.
Doc, kasama na po natin si Ami Pamintuan of the Philippine Star.
Good evening, Doctor.
Hi,
Doctor,
good evening.
may report ngayon from other countries, ang US CDC. They already approved booster shots for yung mga immunocompromised lang naman. And meanwhile, yung report naman from Turkey, they also approved, sabi nila, kung magbo-booster shot daw sila ng Sinovac, mas effective daw na Sinovac din yung third shot. I know that it's too early for us to be talking about booster shots dahil kulang na kulang pa tayo. But you told us, well, we were told earlier na pinag-uusapan na rin ng gobyerno yung possibility of third booster shot. Anong inclination nyo kung sakasakaling magbo-booster shot? Same brand ba or different brands? Hindi daw, sabi ng Turkey, experience nila with 30 million people, hindi daw maganda yung pinagsasama yung Sinovac and mRNA vaccines.
Yeah, so actually every week pinag-uusapan to ng mga expert panel natin, no? And as of Monday, yung Monday na nakalipas, ang recommendation pa rin nila is no booster shots at this time. That it's too early to give booster shots. We should wait for our own mix and match studies and our own studies on kung nagwe-wane talaga yung yung immune reaction, and that talagang concentrate first on vaccinating everybody. So medyo malayo pa tayo, Ami, dun sa booster shots. Talagang as of now, ang paninindigan pa rin ng ating mga expert panel is no booster shots.
But in the meantime, may nahuli na yung Quezon City government, papilan nga daw nila ng kaso. 2 tao kasi yung isa yata nag-post na nakakuha sila ng full vaccination in 1 LGU and then lumipat sila at kumuha ng third shot. Paano bang mapipigilan kaya yung ganon?
Yun nga kasi technically sa batas, wala naman like sa FDA as a regulatory body, wala naman tayong ikakaso sa kanila. Talaga, but it's so morally and ethically wrong, no, to deprive another person of a vaccine just because you fall in line again and then get a second set of vaccines, no? Yun naman pong
from the FDA, anong pwede niyong i-warning sa mga taong kumukuha ng booster shot at this point na hindi pa sigurado yung resulta ng mga studies?
Talagang ano kasi sa atin po, ang ina-approve lang natin is 2 doses of the same vaccine because ito yung may scientific evidence tayo na alam natin na walang masamang mangyayari sa inyo at saka effective siya in the long run, no? So, we really cannot guarantee na pag pinaghalo-halo yan ay walang reaction. Like you said, in Turkey, they're seeing that mixing and matching is not working, no, with the Sinovac vaccine. Until all the data and the scientifically conducted studies are done, we cannot assure na merong na safe yan para sa inyo, and we'd really like ask everybody to refrain from doing that.
Doc, nabanggit kanina ni Ami yung CDC sa US. Bigla ko tuloy naalala, ganun katagal na ba namin di nakakausap si Dr. Domingo? Because I go all the way back sa SONA ni President Duterte nung sinabi niya kailangan meron ding CDC ang Philippines, or at least that's how we understood what he said, that he wants a law that will start the ball rolling on creating what effectively would be our own CDC. Gaano kalayo po tayo doon? What needs to be put in place? And explain to us, how different would a CDC be given the FDA and all the other agencies attached to the DOH that we have right now?
So there are pending bills already in this Congress, sa Senate at saka sa lower house para nga mag-create tayo ng CDC body nandito, and kaya binanggit ni Presidente yun during the SONA is really to give a sense of urgency na kailangan natin siya. Kasi ngayon, it will be patterned after the CDC of the United States, which is really disease control. Kapag may epidemic, pag may outbreak, whether it be infectious or non-infectious, even for example, chemical spills, no? Meron kang agency na talagang ang trabaho niya is to react very quickly to the emergency. Sa ngayon kasi, yung regulatory natin, yung FDA natin, very similar to US FDA. So wala tayong problem doon. Pero yung Department of Health natin, wala silang ganoon kalaki na ahensya that is able to respond to to disease outbreaks and future pandemics as quickly as a CDC, for example, in the US. At ito yung gusto nga nila para meron talagang nakatutok na hindi siya mahawak ng mga programa ngayon sa puso, programa sa pagbabakuna, kundi nakatutok lang at nag-aabang para pag nagkaroon ng mga ganitong kaguluhan or nagkaroon ng ganitong mga pandemic, merong talagang tao, alam natin kung sino yung pupunta doon at magre-respond agad at gagawa agad ng plan.
Kasi kumbaga marami naman tayong iba-iba, di ba? You have FDA regulating, meron tayong RITM, meron tayong mga research facilities. So yung CDC, parang quick reaction team yan, parang quick reaction unit natin yan, ganon?
Yes, kasi sa ngayon, di ba kamukha nun, magko-convene pa yung IATF, kukuha pa ng mga tao kung saan para mako-coordinate lahat. Pero walang nakaset na nandoon talaga, no, na ready to act at any given time. So that would be it's really like institutionalizing a crisis, a health crisis agency that really will looks into this kind of things, and always there. Hindi na kailangan i-activate, kundi talagang activated na sila at nagbabantay every day.
Sir, how different is that from the RITM, or would it just be an expanded version of the RITM?
Well, no, the RITM really is more into research. Kaya talaga Research Institute for Tropical Medicine yan, developing vaccines, checking new antibiotics, for example, or new strains of disease patterns. So, iba pa rin yung trabaho niya, no? Yung kasing yung quick reaction nga, talagang yun yung na health lang talaga ang tinututukan, yun yung kulang natin.
Doc, yung may istorya sa inyo tungkol sa, quoting you, na 735 out of 11.7 million na vaccinate and infect. Can you tell us more about this? Kasi I know it's supposed to emphasize na kukunti lang naman yung nagkaroon ng ganon, di ba? Pero syempre nag-aalala din yung mga tao. Can you put this more in context?
Yeah, that's why we want to share the information with everybody. No? Kasi we do surveillance. Nire-report sa atin yung mga nabakunahan if they get something. And today, I reported on the COVID cases. Usually, ang nakikita natin ang mga mayroon pa talagang nagkaka-COVID is between the first dose and the second dose. Kasi after you get the first dose, you really don't have any protection yet. It only starts maybe 2 weeks after. No? So yung first 2 weeks mo talagang magkakaroon ka pa . At kung ganyan kadami na 11 million na yung first dose mo, talagang meron sa kanilang magkakasakit, no? Na yun nga, itong nakita natin, parang I think 500 or almost 600 of those 700 cases were between the first dose and the second dose. And then, yung meron pa rin nagkonte, parang 100 na after the second dose, but before the 14th day. Kasi yung full protection natin talaga 14th day after eh. Pero yung 14 days after the second dose, very few na yung nagkakaroon, which is what we call the breakthrough infections. No? I think we saw maybe less than 100 of those also. What we're saying is, vaccines, there's no perfect vaccine. No? Wala namang 100% efficacy. Pero nakikita naman po talaga natin na pag nabakunahan kayo, talagang bumababa drastically yung iyong possibility na magkaroon ng COVID. Kasi ngayon, every day, out of 100,000 people, 5 or 6 will get COVID every day. No? So kung yung 11 million na yun, hindi mo nabakunahan yun, in 1 month, ang magkaka-COVID doon siguro 20,000, di ba? Pero ang nagkaroon, mga 750 cases lamang. So nababawas siya drastically at nakikita naman natin, lalo na towards the end, mild na lamang yung mga nagkakaroon ng ng COVID. Very unusual na yung mamamatay pa, lalo na after the second dose. But also tells us na yun yung important. Talagang kahit nabakunahan na po kayo ng first dose, kailangan nyo pa rin mag-mask, mag-face shield at mag-social distancing kasi talagang meron pa po talagang nagkakaroon. Pero mababa na.
Yung among the fully vaccinated, na-track niyo ba kung meron sa kanilang naging critical or serious?
Yes, actually there was I showed the table earlier eh. Dun sa between the second dose and the first dose, there were fatalities, no? I think if I'm not mistaken, hindi ko na lang ma-memorize eh. Parang dun sa 756 and there were like 56 people who died from COVID, no? Mostly between the first and second dose, some after the second dose, and there was just one reported sa amin na died after being fully vaccinated. I mean, 2 weeks after, lamagpas na ng 2 weeks after the second dose. So, talaga pong pwede pa rin pong mangyari. No? Hindi naman namin sinasabi. But, 1 out of 11 million, I think it's a good, naman. Ako naman, I would still bet on a vaccination for myself and for my family.
Sir, but we're sure you're aware of some of these claims coming out, some of them even from medical professionals, that vaccines are more dangerous now than COVID, and that there's a cover-up of information on the adverse effects. Now, typically we don't bother with those kinds of claims, but these issues have come out on social media and they've gone quite viral. So we do have to address them. What do people need to know about these claims?
Yeah, I don't know what they mean by more dangerous. No, since we started getting COVID, 30,000 people have died from COVID, and almost 2 million people have gotten COVID. No, and we see that it's drastically decreasing. Pero like I said, everything naman, meron naman talagang adverse events, merong na-hospital after the injection. Yun nga po, meron talaga pong nagkaka-COVID pa. Wala naman pong perfect vaccine na 100% walang adverse event at saka na walang breakthrough infection. But what we keep reminding everybody is the benefit outweighs the risk. No? Whatever risk there is, definitely po mas matimbang yung benefit na makukuha natin at yung protection na maibibigay niya sa atin kontra sa COVID.
Yes, sir. But there's another angle that has come out recently. One of them even came out in our episode yesterday or last night. The angle na parang sobra raw alarmist and sensational yung response ng gobyerno at ng society dun sa COVID. Because according to some people, and these are not and some of these people are not necessarily on the fringe, they claim that there are other diseases that are more dangerous than COVID. If you look at the mortality rates daw, for example, mas marami rin namamatay every year from heart disease. Well, that's one. Tapos, for example, daw, dengue and tuberculosis. What do people need to know about these things? Are we looking at apples and apples or apples and oranges?
No, well, it's true. No, more people will probably die of heart disease, for example, than COVID. Kaya lang yung COVID, nakakahawa siya. Bawat isang may Delta variant, may 8 pwedeng mahawa. And never na puno ang mga ospital natin na nakapila na lahat ng ICU, nasa mga pasilyo na, nasa kalye na naghihintay. Na nakikita natin. Dahil tayo naman po, ako 52 years na akong buhay. Ngayon lang ako nakakita ng ganito na lahat ng ospital ay punong-puno, puno ang ICU at talaga pong namamatay araw-araw ang mga pasyente. No? So, hindi naman po kasi pare-pareho lahat ng sakit. No? Ito ay infectious disease that, if not controlled, will continue on infecting people for a long time. So, we have to take each and every health emergency separately and differently. At talaga pong kakaiba ito. Sa buong buhay natin ngayon lang po nagkaroon ng ganito.
Doc, I mean, we keep talking about vaccines, pero sa mata ng FDA, you're monitoring a lot of things. I'm just curious, meron ba outside of vaccines na development sa COVID na interesting for you or at least that is on your table?
For treatment, there are so many now, Robbie. No? In fact, in the country, in the Philippines, there are now 25 ongoing clinical trials on different kinds of management. Meron mga monoclonal antibodies, meron na tayong nakikita na babasa ng mga spray, no, mga sinispray sa bibig at saka ini-inhale. So nakikita naman natin na meron na akong nakikita sa horizon. I believe by next year, by 2022, we'd have fully developed vaccines that will be registered, but also treatments that have been proven to be useful and that will be able to that will be available commercially to everybody. So talaga naman pong lahat ay naghahanap ng solusyon para dito, whether it be for diagnostics, prevention like vaccines and therapeutics.
Doktor, labas ako sandali ng konti sa FDA. Iimbestigahan daw ng Senate ang Department of Health for deficiencies in the use of COVID funds. Meron po ba kayong what are your thoughts on this?
Well, I think alam niyo kami naman alam niyo naman ang COA every meron kaming opening meeting and then meeting in the middle and then meeting in the end. And sometimes, of course, the department just has to explain why funds are not moving as quickly as they should or kung bakit na-deliver na at hindi pa nababayaran agad. No? And I was with the department for at least 2 or 3 COA mga ganun na mga meetings before ako nag-move sa FDA. And usually, na-explain naman nila, napapakita naman nila kung bakit yung pera ay nandoon pa, pero umaandar naman yung kanilang mga programa.
Na-revive na naman pati yung issue na yung hindi daw nagagamit yung mga gamot at malapit na mag-expire yung...
195 million daw.
Yes.
Well, yeah, I think ilang taon na rin na nga natin narinig yun. I will have to leave it to the department to explain that. No? I mean, that was something that's always been very frustrating within the department.
Well, sir, the other aspect of that is mga 24 or 25 billion pesos na unobligated funds ng DOH na in the end binalik instead na magamit sa of course, other uses that could have helped in the fight against COVID.
Yeah, well, I mean, as somebody who works for government, like sa FDA, alam ko naman na minsan napakahirap talagang gastusin ng pera, na para mag-procure ng something, magkontrata ng something, or magpa-construct ng something. Sa gobyerno talagang minsan nahuhuli tayo. But of course, I mean, we really just, you have to do your best. You ask for the budget, you have to use it, and you have to use it properly to deliver the service. No? And I believe naman the Department of Health will be able to explain this.
Okay. Director General of the Food and Drug Administration, Dr. Eric Domingo. Sir, maraming salamat po.
Maraming salamat po.
Happy weekend, sir.
Happy weekend, sir. Please stay with us. The Chiefs will be right back. Welcome back, the Chiefs here on One News. Now joining us, DOH Undersecretary Leopoldo Vega. Good evening, Yusek Vega.
Good evening, sir. Good evening
Good
to
evening,
all
sir.
po. Good evening to all.
Opo. Yusek, umpisahan po natin, medyo pinasok na natin kanina with Director General Domingo of FDA, itong COA report on the DOH. Now, COA today did go to great lengths to stress that by deficiency, they were not suggesting corruption. They were not saying may nawalang pera, but a lot of people are still saying, oh, even without the corruption, it still suggests inefficiency. It still suggests, as something that was touched on earlier, absorptive capacity issues with spending and operations. Your take,
Management.
sir. I mean, how does the DOH begin to explain to the public what that COA report was referring to and addressing?
Yeah, first of all, sir, the AOM, or this Audit Observation Report, comes out in the annual report of COA. And on our exit interviews, we get already the notice that about 67 billion of all of these deficiencies across various operating units of the Department of Health, because this is a consolidated audit report, and that's 114 operating units with those deficiencies. Now, these deficiencies are actually compliance issues, or documentary, or even procedural issues. So most of the time, the COA would give us a recommendation out of this observation to rectify it, and tell the direct officers to provide the necessary papers, documents, or make sure that they do the proper procedures. And most of the time, we are able to do this. So the report of COA is really not final, because we are given notice to do something about some of the deficiencies noted. But the 67 billion, which has been flagged, is all accounted for. It's just that the manner, the procedure, and compliance in terms of doing this in the various units needs to be responded in terms of providing the necessary compliance and supporting papers.
Malinaw naman po yun. A lot of it has to do with documentation, as you said, and as Mr. Domingo was saying, he is fully confident. Sabi niya, matagal na nga ako sa DOH. I'm sure kaya namang explain karamihan dyan. But in one item in particular, 11.89 billion, that COA said is unobligated, and basically sabi ng COA, sayang. This could have strengthened the department's capacity to address the COVID-19 pandemic. When you say unobligated, I mean, tama po ba intindi natin? This is not a documentation issue. This is basically something na nasayang.
No, that's not utilized. As of December 31, 2020. But it also means that when we had this report coming from COA, we did a reconciliation of all the funds that were released and the SARO. And the total exact figure is actually 10 billion, which actually was a part of 5 billion of that was really a part of CONAP, of continuing appropriations for 2021. So in other words, 5 billion of this was really spent and utilized until June 30 of this year. And most of this were actually provided for the health COVID response, such as the salaries for the augmentation of the healthcare workers, some of the PPEs, and augmentation of the MOE in the different operating units. And the rest, or the difference, came from the foreign assisted projects, yung FAPs namin. And we were able to utilize that after December 31, because it needs some amount of procurement and bidding, and we were able to procure almost 119 ventilators, about 200 X-ray machines for that fund that was given. So in other words, out of the unutilized fund that was flagged by COA of December 31 of 2020, meron po kaming na-spend na almost 84% utilized. So that's a fair enough kind of resourcefulness in terms of procurement and buying.
84%, malaki-laki pa rin yung matitira doon. Ano
yes.
kaya yung problema doon sa, well, it's an absorptive capacity problem. Ano po yung problema doon? Kasi ang iniisip ng mga tao, we're in an emergency, we're in a crisis, and we're borrowing a lot of money from overseas.
Alright, okay.
Na ang utang natin, bakit daw hindi nagagamit yung pondo?
Pero tama ma'am, yung actually this is foreign assisted projects that's and a majority of this already has been utilized since 2021. Pero may difference pa ng something like 1 point something billion. And that actually was for the vaccines intended for December. Bibilihin sana for January, but it never materialized. So when it didn't materialize, because the vaccine cluster wasn't able to get the guarantee of the suppliers that they were able to deliver, they were not able to do so. So this was returned back to it's a foreign assisted project to ADB or to the general fund.
Sir, let me frame it this way, sir. Kasi you were able to whittle down 11 billion to around mga 1 billion plus
Right,
that had to be returned or were unobligated. Which is fair. Nagastos man po yung karamihan. Pero doesn't that frustrate you po? Considering you're the treatment czar and you're always looking for funds na mga gamit to expand our capacities,
Right.
to better treat people. Tapos parang kahit pa paano 1 billion din yan na parang sana nagamit ko yun.
Ed, yeah, right. I understand you very well, Ed. No, pero these funds kasi has a certain intention, and the intention of the foreign assisted project at the time as contracted with the government, the Department of Health, was really to buy vaccines, because we were trying to ready ourselves to buy vaccines at that time, and they were readying 1.3 billion of this to buy the vaccines, which didn't materialize because we couldn't get. That was early, last year. So they couldn't get a good supply for this fund, and so we were not able to use that. So in plain and simple, it went back to the general fund.
Mm-hmm.
Would you know kung anong brand yung vaccine that you were trying? Because we remember, well, the Secretary Chodoro Locsin was talking about negotiations with Pfizer as early as July, no? Through the US State Department. Ano kayang brand yung balak yung bilhin with the 1.3 billion?
Actually, ma'am, hindi kami, kasi kung foreign assisted project, it's the vaccine cluster who will actually do this. And we will just ready the amount in our office. And these are even, we will just get a disbursement of this, and then the payment is done to the banks, no? But I wouldn't know. I wouldn't know what the intention was for the 1.3 and what kind of vaccine was that at that time, last December.
Okay. Yusek, punta po tayo sa COVID situation in general. In particular also, let's zero in on the hospitals situation. Let's start with the reminders of the numbers today and over the past 3 days. 13,000 new cases today. At kagaya nga po na pinopoint out ni Bok, 23.6% ang positivity rate. We're moving from 1 to 5 to 1 to 4. Your assessment, sir, of where these numbers are headed, and how is this being felt in our hospitals right now?
Right, sir. If you try to look at this, sir, and compare this with the last few waves that you had last year and this April, this is really different because we do have several hotspots. In the last year and this April, we know that there was a cycle of spike of cases in NCR, in Cebu, in Davao, and other places, and it didn't materialize simultaneously. And this is really different now because the hotspots that we're seeing is that there is an increase in the number of cases in Region 1, Region 2, CAR, 3, 4A, 7, 8, and NCR, 10, 11, and there are now more regions on the high alert level 3, and even alert level 4, of the risk classification. And NCR is really on the main contributor of these new cases right now, giving out as much as 26% of the new cases. Roughly today, NCR, we have 3,000 plus. But if you take a look at this figure, you would say that even if there is a rise, and we would say that uh, it's a slope that gradually is increasing. The hospitals are still able in the NCR to manage the number of cases that we have. Because right now, 93% of these affected individuals are really having mild and asymptomatic cases, and only about 1.6 to 1.7% are severe and critical. And the only way that we can manage the severe and critical patients is really to expand the number of beds in the institution with a trade-off that the non-COVID patients can no longer access as much as they want, because there's now a transformation of one institution into more of COVID cases. Because last April, the only way that we can, provide more beds is really to access these patients to different areas like Region 3 and Region 4A, and even as far as Nueva Ecija from NCR, we were able to manage this in terms of a coordinated care. But now, it's different because Region 3 is kind of saturated in terms of the number of patients, and Region 4A is also very much saturated in terms of the number of cases too. So in NCR, what we're saying is that we need to ramp up the number of beds. And this is the reason why we were able to inaugurate the modular hospital, which we built 2 months ago or 3 months ago in the kidney center. And that's going to give us as much as 110 for critically and severe cases. And we are going to inaugurate also by next month 220 bed of the modular hospital at the National Mental Hospital in Mandaluyong. So in other words, we are trying really to ramp up and scale up the number of beds, because we know very well that if we can't control the number of new cases, the tendency really is that there will be more and severe critical cases as the numbers rise.
Yusek, ang isa pa naming nakikitang bago ngayon with this surge, apart from napupuno na naman nga yung mga hospitals natin, all the hospitals are saying na tumataas yung number of patients nila, pediatric.
Yeah.
So, ano pong treatment ang maaasahan ng parents if they go to the hospital with their sick children?
Alam mo ma'am, that's also one of the things that has been noticed, ano, kasi yung alpha beta na variants na dumating sa atin, hindi naman talaga tinatamaan yung mga the younger population, but we've seen an increase in the 0 to not 0 but 5 to 17 years old or 15 years old, and we've noticed that there seems to be a rise in this, and the treatment is basically the same. For COVID, it's for the treatment, even in pediatrics, it's still the same. You have to give yung antivirals and dexamethasone. But what is very important here is that these patients must be given due access to any hospitals, because these children mostly that are getting afflicted are having yung pre-existing diseases, mostly with heart, and they do have cancer, or they have problems with their health situation. So ito yung very fragile and sometimes that we really have to take care of, especially these pediatrics who have comorbidities.
Sir, but the increasing number of kids who are getting hit, is that because of the increased transmissibility of the variant, the Delta variant, or is it something else altogether? Is it because the variant tends to target the kids more? Which is it po?
No, I think it's because of the variant, which is really highly transmissible and highly communicable.
The transmissibility.
Yeah,
So the bigger the population that gets infected, of course, the bigger number of kids who get infected too.
right. But the thing is, if you take a look at the data in terms of demographics, it's usually the working population, 25 years old to about 59 years old. That's where the majority is. That's where really the majority is, and the great number of COVID cases are. But however, in the 5 to 15 years old or 17 years old, there is an uptick. It has been steady for a longer time, but there is an uptick and there is an increase. However, it is not also very significant in the sense that it altered, the number really that is seen for several months. But it has increased, and definitely the afflicted children are more on this group who have the comorbidity, especially with heart and, of course, cancer conditions.
In the meantime, Doc, given lahat po ng naobserbahan nyo, lahat ng nakikita natin, how does that make you feel about the current ongoing ECQ and what we might be facing by August 20?
Ang ECQs kasi sir, the ECQ that we have right now is totally different from the original ECQ. I think it is now is a hybrid, and you can see more people moving compared with last year. And I guess this ECQ, the main reason why we are the NCR is flagged to be escalated to this quarantine position is that it would like to maintain as much as possible mobility and lessen the transmission, and of course the super spreader events. However, the balance of doing the economy, of making sure that essential work has to be there and essential services has to be also there. And if the LGUs in the different cities can actually intensify the preventive aspect, compliance of the minimum public health standards, the isolation of patients who've been noticed to have symptoms and contact traced, and these are isolated at once in less than 48 hours. I think we will be able to lessen the transmission and, of course, delay the increase of the number of cases. On the other hand, we also have to vaccinate us more, because the more people are getting vaccinated, the more we will have a wall of protection in our community. So, and this kind of strategy, prevention and the vaccination, will actually keep the hospitals in a manner that can actually serve, because it will not be overwhelmed.
You said you're talking about hospitals ramping up their bed capacity. Pero ang isa nilang malaking problema, they've been telling us about it, kulang na kulang sila ng health personnel. Kumusta naman po yan in that area? What are we doing?
Yes. Yung ano, that's very true po, Ma'am Ami, kasi one hospital, if you have to convert a certain wing or a certain ward to become a COVID ward, it takes a different proportion in terms of human resource, kasi may mga rotation na yan every 14 days, times 2 ngayon times 2 or 2.5 of the human personnel. Kaya nga minsan, pag nagko-convert sila, yung mga areas nila for non-COVID, they try to decrease this so that the manpower will be shifted. But of course, there is always a lack in terms of the manpower. And we have been, I think, for the NCR, we were able to position almost 5,000 or 3,000 plus, 3,000 healthcare workers to augment the different public and the private hospitals. And we are again saying to the DBM, we wrote them that we need again another augmentation to continue this number of nurses that we position for the National Capital Region. At the same time, increase this so that there will be more healthcare workers for not just for the hospitals, but also as vaccinators and the surveillance. So I think this is now with the DBM, and I think we're very much optimistic that we will get the funding for this.
You're talking about new hires or are you moving personnel again? Kasi pati sa mga probinsya, kumalat na yung Delta.
Oh,
Are
new
you-
hires, ma'am. We are proposing actually, aside from the 10,500 that we already positioned across the country, and we need to extend their services, and meaning to say until December. So we are asking for funding for the extension of the services plus new hires, because we know for a fact that there are now hospitals writing to us to provide them with the necessary healthcare workers. And we're trying to do this new hires with this new funding if it comes, so that we will be able to provide the different institutions.
How much po yun, yung new funding? How much?
Total po sa new hires together with the vaccinators, together with the healthcare workers, pati yung mga biosurveillance team, that's about mga 3.3 billion po across the country.
Pero yan po yung total. When it comes down to the individual packages being offered to nurses, for example, may nagbago po ba? Because
Wala.
because this is one of the things that I know the health sector has been trying to figure out. Because on the one hand, we have a surplus of nurses and we have a shortage of nurses at the same time. And they always say it comes down to the money. It comes down to the package. How is this emergency hiring and this extra fund? How is this supposed to be different from all of these months na maraming mga nurses na hindi pa rin pumapasok sa workforce?
Ang position sa, say, for a nurse, and the salary that goes with it, it's actually standardized. If you're a nurse one hired, then we will be given a nurse one position and with a certain salary, that's a standard for government. And the thing is, the salaries for the government side, like for a nurse one, let's put it at 35,000 or even 40, and the salary grade of a nurse in a private institution is really way below.
Yeah,
so
lower.
it's about 15. So there is a parang internal migration
Yes.
of nurses coming from the private sector towards the government, because it's more, the salary, the rates are kind of higher. And this is also what we have been seeing, that the private sector has been complaining about this, but because of this kind of migration towards the government. But we have been also saying to them that in this time of crisis, whatever needs that you have, especially for the human resources, we will be able to support you through the different regions.
So it's the creation and the opening of these new positions in the public health sector. That's the difference now.
Yes, right.
Oh. Okay.
So, saan kaya kukunin yung pondo? Yung pinopropose ninyo? That's an
Sa
emergency.
DBM. That's actually po, sa DBM po. So I wouldn't know where they will source out the funding, but if they're talking of a biennial 3, that might be very possible.
Sir, balikan ko lang po, naalala ko lang, so if we create these new positions, these new openings for public hospitals in the public health sector, given what you discussed nga rin po sa private hospitals, how do we ensure that it doesn't have the unintended consequences of more internal migration from private hospitals to when we say new hires, how do we ensure that those are in fact new hires and hindi lang tayo lalo nag-i-entice ng more nurses from the private sector just moving to the public sector?
Marami kasing there are new graduates now, especially with the recent passage of the new nurses right now. That's our first, that's where our recruitment would be, especially yung mga new nurses na dumating ngayon. And then also there are new nurses coming back from abroad, which we can also tap. So ito yung these are the areas that we are looking into in terms of
Pero sir, what's to stop a private sector nurse from applying with the public sector kung dobleng sahod niya? I mean, in the end, could you or would you stop them from moving over?
No, we can't. There are two things. That's internal migration, and the other is the external migration when they go for a higher pay abroad. So those are the kind of, those are the dynamics in terms of, especially with the healthcare professionals.
Yes, sir. Well, I asked about that kasi although in the end you might have good numbers across the board in terms of nurses, pero you might naman have so many nurses in the public sector or the public hospitals. Tapos bakante naman sa private hospitals where there are facilities and beds available. So you might have that kind of an imbalance naman. How would you prevent that?
Yeah, but the thing is, with the private institutions, especially the level 3 private institutions, what actually attracts some of the nurses, even if the salary is low, is because of the training and the training that they will have. And this will actually position them for a better kind of job abroad or the transfer. So in other words, it's the training that they acquire. It's sometimes it's not just the salary that goes with it, but the training and the kind of work that they'll be doing in that institution, like a specialty, like a dialysis nurse. She can be paid not as much as a government dialysis nurse, but she knows that the
It's
hospital
experience.
is accredited abroad, and that she will have a good training. So that's really a real come on.
Okay. Well, napaka-komplikado po talaga. We really sympathize with you, and we also appreciate your time, sir, and your patience to explain to all of us.
Yeah, trying my best, you're also trying your best here, just for public service.
Yeah, pa.
Salamat po.
We
Salamat
appreciate it, sir.
Thank you,
We
sir.
appreciate it.
Ingat po.
Maraming
Thank you,
salamat
thank you.
po. Health
Thank you po.
Undersecretary Leopoldo Bong Vega. Stay safe, sir.
Stay safe too, sir. Have a
Happy
good
weekend
weekend. Or a happy weekend.
And that will be all for this special edition of The Chiefs. We hope what was discussed here will keep the conversation going. Before we go, a reminder to our viewers, mask on, wash hands, and stay safe, Philippines, and get your vaccines. I'm Robbie Alampay.
I'm Ami Pamintuan of the Philippine Star.
I'm Ed Lingao, and we are One News.